there, and welcome to Canceling COVID. Back with you once again. So grateful to be back live after some much needed time away and just doing some different things. I want to shout out last week, if you get I wasn't able to do it live, but go to the link. I had a beautiful individual by the name of Amanda Henderson who stepped in and talked about heading back to school and some of the concerns that parents are having around the vaccine. A great conversation. Again, it's on my YouTube channel. And subscribe while you're there as well. I wanted to make sure I plugged that because last week it was pre-recorded and it's simply the link right here at Tanya Rivens Live. Thank you all for hopping on. Thank you. I see you joining us as always. And I welcome your comments and invite you to share any feedback that you have as well. A little late getting started. You know, life happens. It's just one of those things. But again, you are here and we appreciate that. So there's a lot to talk about, a lot to tell you about as we are consistent with bringing you real talk, real solutions, real resources, and real people speaking to our community about what's happening with COVID. A little bit cloudy on the outside, chance of some pop-up thunderstorms, but we know the SON is always shining. And certainly a lot is happening in our community, but why not go ahead and dive in and talk about what is happening, and it concerns the numbers that are starting to spike yet again when it comes to COVID. If you recall, we were here about this time last year, and I can remember it very well because I have my annual outdoor event coming up in September 17th, and I remember, being very concerned about the numbers and what's happening with the numbers. But, this time around, we are a little bit more educated. We have a better idea, I would like to think, of what we're dealing with, where we're heading, and how to focus on this. And so let me just give you some of the numbers that are happening right now. We are 50 counties in the state out of 100 are in the high zone, which is the red zone. And the red zone means that you should be wearing masks while you're indoors. And of course, this is based on the amount of cases, the hospital beds that are in use, the admission, and then, of course, the total number of new COVID cases. So admissions, hospital beds, and the total number of new cases. 50 counties right now in the high zone, meaning you should be masking while you're inside. Well, the counties around Mecklenburg that are in that zone right now is Rowan, Cabarrus, and Gaston County. So if you're listening, someone in those areas, kind of just share with them how important it is for them to get back to some of the precautions that we were doing before. So what are the other zones? Of course, we got the low and the moderate. And right now, Mecklenburg County is still in the moderate zone. Let's try and keep it that way. If you're indoors, just pop the mask on. If, washing your hands and doing the physical distance, which is really, really tough to do, I have to admit, because most people don't acknowledge and aren't interested in doing that. And so it's kind of tough. I've shared before where I've tried the physical distance, do that 6 feet apart. And, a person would just get closer and you would move a little more and they would just get closer. And I sometimes in a joking way say, hey, I'm just trying to, stay my distance. And then they would, I did it with a smile, of course, and then they would honor it. But some people just aren't thinking because first of all, we've got burnout. It's been going on for so long. And secondly, it's easy with everything else that we're trying to deal with to not have that on top of mind. But we really need to get back to that and start focusing on, the president didn't have a choice. President Biden recently diagnosed with having COVID, and we've got a lot of conventions and family reunions and gatherings. I'm involved in some, and it's kind of tough, but make sure that you're taking the precautions to do whatever you can to protect yourself. Now, you and I both know I can't have this conversation alone, and I have to bring in none other than Dr. Tracia Black to help me out with this conversation, because what she always does as a resource is she brings in that professional aspect and also shares elements that I wouldn't be able to share with you, especially credible. So we had an opportunity to talk earlier. Here's Dr. Tracia Black joining the conversation, everyone, as we continue. And you've heard me talk about now the figures that we have. Mecklenburg County, we're still in the moderate zone, which is encouraging, but we may be seeing a shift. We were here about a year ago, so I can't have this conversation alone. However, joining me, she's our in-host or in-studio specialist is the best way to put it. None other than Dr. Tracia Black. Good morning. Thank you for joining us.
Good morning. Thank you for having me, Tanya.
Absolutely. And of course, Dr. Tracia Black is with Groundwater Solutions, groundwater-solutions.org, 704-596-0505. So we're talking about what's happening. This is our conversation today, just to make sure people are aware that we are seeing some signs of COVID spiking again. I mentioned the variant, the Omicron variant, BA.5. It doesn't mean a whole lot to people that aren't involved in medicine, but just to know that there are a bunch of subvariants out there. And yet here's another one that seems to be spreading quickly. You're out in the community, not just in Mecklenburg County. What are you seeing around the state? Because we've been advised now at least 50 of the 100 counties are in the red zone, which is in the high zone, which means that masks should be worn inside.
Yeah, so I think we're seeing the same thing that the numbers are showing you, Tanya. We started getting calls last week about counties that are interested in resuming testing, not necessarily the large sites that we've had in the past, but that they want to resume some type of testing. And we're now having those discussions about what that will look like. We're getting calls from some jails, some facilities around the community that are seeing spikes, not only in those facilities, but in surrounding sections of the community.
Well, when you go in and test it, what kind of symptoms are people having? You know, our President Biden, just diagnosed with COVID, I believe, the latter part of last week. These symptoms seem to be a little bit more moderate, would you say?
I would say that there's a mixture, Tanya.
Okay.
There are lots of folks who are having the mild cold-like symptoms, but there are now, there's a return to some of the more severe symptoms where folks are not necessarily, they're having some breathing damages or damages to their lungs. Have someone very close to me who is, you know, our goal is to keep her out of the hospital because she's had such damage to her lungs related to COVID. So I think it's not something that we should take lightly. We're seeing activities being shut down. I've had meetings in some of the northern counties where they're being canceled and everything's going back to a virtual format in those communities. So it's something that we should be taking very seriously. You know, those communities who are not masking, I am suggesting a strong return to masking.
So, and that's one of the recommendations, because a lot of this is based on not just the testing, but also our hospitals and the beds and how many people are entering hospitals. You mentioned someone close to you. We had someone in the community that I know that passed from COVID. And I had a really quick conversation with someone with Mecklenburg County. I was like, you know, are we seeing kind of who's passing away from COVID anymore? But clearly we have to be aware of that as well because of underlying health conditions.
Absolutely. And I think, you know, we got to a point where we have not seen people walking around with masks on. We haven't seen those red alerts on the news anymore, but we are in a stage where it's coming back. And what we know about COVID is that once it's unleashed, when there's a spread, there's a spread. And in order to control the spread, we've got to resume taking activities that we know will limit exposure. You know, there was, I went downtown Charlotte this weekend to the Omega Psi Phi fraternity convention, the conclave. And I saw some people wearing masks, and I was thinking to myself, how many folks are, as a result of this or other activities like this, are going to see an increase in numbers? And these are folks who are coming from around the country. They're going to return back to their communities. And if there was a spread, then they're going to, you know, triple and double and 10 times the spread by going back out to where they live and not taking the necessary precautions. It's simple things we can do to keep us safe, and we just don't do that very well.
So give us a refresher reminder. What are the things that we should be doing?
Number one is masking. You know, if you're in a setting where, and I kind of use the rule of thumb, 10 or more people, wear a mask. You know, keep your social distance. Don't get in each other's personal space. Keep your social distance, and also to practice good hygiene. Wash your hands. Wash your hands frequently. You know, use the hot water and wash for 20 seconds, or sing a nursery rhyme, something that reminds you to extend the length of time that you're doing your personal hygiene. And I think those are the three basic things that if we return to doing those, then we can be safe and our families can be safe.
You know, one healthy habit, not that everybody would go out and buy an Apple Watch, but it's got a timer on there. And if
Mhm,
you stop washing your hands before the time is up, it automatically clicks on when you start washing. And if you stop,
mhm,
it'll tell you, hey,
mhm,
the 20 seconds of washing, it'll remind you of that. And I think that's a nice little feature because it's gotten me in the habit of making
mhm,
sure that I just scrub really well. And I like having the sanitizer around too, especially the
mhm.
ones that smell
Yeah.
really nice that you can
Mhm,
rub on your hands. But interesting that you said that because we know it's family reunion time,
mhm,
lots of conventions. I just got back from one in Miami, heading to another one in Vegas. Now, the one that's coming up, they are requiring that you are vaccinated
mhm,
and that you wear a mask. And you had this long process, even before you register. You have to
mhm,
prove that you've been vaccinated because it's a combination. It's a huge convention. But
mhm,
one of the things that people may be kind of trying to figure out is, when you're coming in, if you're masking and nobody else is, then is that really going to be helpful? A, I want you to respond to that. And B, this convention I just came from, I did get a note, which I'm not surprised. I masked as much as I could.
mhm,
Some people ended up testing positive.
mhm.
Thank goodness I did not.
Mhm. Well, I think that's where the protection comes in. Even if the whole room has no mask on and you're the one person that does,
Mhm.
if there's a spread, you are the least likely person in the room to be impacted. So we have to think about our own personal health and our own personal safety, not necessarily what everybody else is doing. But I hear that. I hear folks who say, I'm tired of the dirty looks, and
Mm,
people can be rude
yeah.
and very direct and worried about somebody else's health instead of their own. So, we've got to be able to shake that off and think about our own personal protection. I think
Well,
is very important.
I'm surprised to hear that because it seems like people are a lot more considerate, even when flying. They make sure they announce we no longer have to mask, so be respectful of people that are wearing it or make the decision not to. So hopefully people can look beyond that. But again, the importance is we are seeing cases to start to spike again. So what are your thoughts because of outside events that are also happening this summer?
Mhm.
Is it okay to take the mask off?
Well, again, if you're in there are folks 10 or more who are in your space, then I
Mhm.
would wear a mask. Outside is better than inside because you have,
Right.
the ventilation problems indoors. So there is less risk, but again, there is still a risk. And as
Yeah.
long as the numbers are going up, we have seen historically during this pandemic that once they start rising, the only thing that will make them stop rising is reduction in exposure. That means offices shutting down and you know folks being isolated. And we
Right.
don't want to return to that place where
No.
we've got whole buckets of communities that are shut down.
Mhm.
So if we don't take the precautions to reduce exposure by masking, hygiene, and physical distance, then we're going to end up having so extreme numbers that we're going to have a requirement of shutting down, and we don't want that.
Well, hopefully, I don't know if even the country can sustain another shutdown. So certainly, taking the precaution or the precautionary measures help. Not to mention, we've got our young people getting ready to head back to school, and we know that's a
Mhm,
whole nother element that we don't want to cause for them. I'm just hoping. At one point, though, I thought we were talking, or you heard about the herd immunity, and that
immunity.
everyone's had it, and that we're okay. Why isn't that still impacting these numbers?
Well, I think because, like with any living organism, there's evolution, and
Mhm.
so COVID is evolving, just like any viral infection, any process. And so we're seeing that the vaccines are effective for most of the strains of COVID, but there are some new strains that are coming out that are being able to weave its way around the defenses that our bodies are building up. Again, we're seeing less severe illnesses.
Right.
But some of them are severe, but that's happening less frequently. But they are getting the evolutionary migrations of the virus are getting through our defenses. And so you're going to see that the vaccines are going to evolve over
Mhm.
time too. So we're having to kind of speed up to keep ahead of what's happening in nature.
And so, that would lead to the additional boosters that will
Hmm.
probably be required for the fall, and by the way, it's being recommended that you go ahead and prepare to get them now so that
Hmm.
you, don't have to wait in these long lines and this big demand that is, predictable that
Mhm,
we'll probably see in the near future.
mhm.
COVID seems like the big boogeyman that just won't go away. I mean, it
Yeah,
seems like everything that we're trying, there's the next move. Okay, now what?
and we have to be progressive and plan ahead and kind of be predicting what may happen in the future. I think we still have that major hurdle that is the elephant in the room, though.
Mhm.
If communities resume testing and there's no funding for it, then how is that going to happen? So we're all kind of trying to be on standby and be ready whenever there's a call to go out. But we're asking that question of how this is going to be funded. If you remember that an organization like mine and some other sister and brother organizations, we,
Mhm.
put on our battle gear and uh, went out mobily across the state. And we had enough funds to somewhat sustain that. Now with no funding available, you can still, if somebody has health insurance, you can recoup some of your expenses, but a lot of folks don't have health insurance. We're not yet at Medicaid expansion in North Carolina. So the question is, how are we going to fund it? Do we have the resources to travel around to those rural communities who otherwise would not have access to that testing? And it's in the rural communities where we see the spikes.
So let's talk about, and you mentioned the rural communities I mentioned earlier in our areas, Cabarrus, Rowan, and Gaston,
Hmm.
i.e., as you just mentioned, pretty much rural. They're
Hmm.
outside Mecklenburg County. But this funding question keeps coming up, and it's just kind of hard to process. I keep going back to all this COVID relief money that was put out, and a lot of people were trying to decide what to do with additional funds, whether they were giving additional bonuses to employees or somehow using, I know there were strict guidelines on how they could use it. You're saying that even with that funding, nobody thought to kind of keep some of that around to help with additional testing? And I know
Well,
you can't speak for
yeah,
everybody.
I can't speak for everyone. I think if you can imagine, there are different pots of money, and so
Mhm.
there was a pot of money for community-based response to COVID-19, response in the
Uh-huh.
way of food, social determinants of health, housing, um, transportation, and then we thought that this pot of money called HRSA, we talked about that it would be available to cover testing and medical needs, and all of the COVID relief went to grants for programs that help people, but not necessarily that medical piece. And
Right.
with HRSA not having the funds, then the medical piece is what's going to suffer. And the medical response is what we need right now to control the spike. Because again, we talked about the three kind of hygiene things that we can do, but testing is clearly one of the major things, early detection. And so with testing not being readily available, then we don't know how we're going to identify when there's a spike. And again, if you look at the numbers and we see spikes when we know that testing is still at less than 10% of people, then what really might those numbers be?
So you just mentioned spikes. That's a good segue to my next question, real quick. Monkeypox.
Hmm.
We can't ignore that it's growing on the world stage, and the
Hmm.
U.S. is trying to decide, I believe, the terminology of whether to declare it an issue
Hmm.
here in our country. What can you tell us about monkeypox?
Well, I can tell you that monkeypox has been declared a worldwide emergency from the World Health Organization. Within the United States, we have not taken that stance. I think the numbers that we're seeing is 27 to 30,000 across the world. We've got about 3,000 here in the United States cases of monkeypox and 27 cases in North Carolina. So the U.S. has not declared it because the numbers are not extremely steep. I think New York might be the city with the most infections, and they're at
Mhm.
about 800. So, with COVID, is so fresh to us and we're still in the middle of it, there is some hesitancy to declare another state of emergency in our country. We're all kind of panicked and we don't want another extreme. What
Right.
I can tell you is that monkeypox is infecting males
Hmm.
um, more than females, folks who are same-sex relationships more than heterosexual relationships. I don't yet know all of the reasons why that is, but we do know that those are the populations in which it's spreading the fastest.
And I believe it's also by contact with an individual, and it even can be on a towel or bed
Mhm,
sheets or things
mhm,
along those lines. And vaccinations are available for that, even here in
mhm,
Mecklenburg County. It may be a wait. Now, I also saw a story
mhm,
earlier today about the county testing the water to see
mhm,
if monkeypox is in there as well. So we
mhm,
definitely have to keep an eye on that. I
mhm.
appreciate your time and thanks for
You're
weighing in on that
welcome.
as well. As we wrap things up, is there anything else you would like to share?
As always, we are rapidly trying to staff new programs. You know, there's a term called the Great Resignation. Maybe we can talk about that one week. That COVID-19 has led to this space where there's just such a worker shortage. So I would say if anybody's interested in the healthcare arena, community health work, even if you're new to the field and you have a passion, we are always looking and we're connecting with organizations statewide for folks who want to do the work that we're doing. So
Great, great stuff. And I just put the information up, groundwater-solutions.org, 704-596-0505. Dr. Tricia Black, I appreciate you and
thank you.
thank you again, as always, for taking the time to talk with us.
You're quite welcome. Have a great day.
You do the same. Well, folks, it's time for us to wrap things up. I certainly appreciate you. What do we have going on? Let's see. Lots of things happening. As always, of course, I'll see you on this Saturday at 10 a.m. for Sounds of Inspiration, again from 10 until 2. There may be some other stuff happening. Make sure you follow me on social media. I'm at D. Tanya Rivens and Tanya Rivens Live on Facebook, Instagram, and Twitter, and I'll keep you updated. I want to shout out the good folk over at that handled all of the conclave. Dr. Black mentioned she went uptown. My bros in town. Omega Psi Phi Fraternity Incorporated, and boy, did they do a really good job on events that they've hosted all around the city and keeping things really focused on what they represent, which is service and working in our community. So we are so grateful for that. As always, life's challenges make you better, not bitter. I'm Tanya Rivens. Enjoy your day, everyone. Be prepared for pop-up thunderstorms. Be well, be safe, be alert. Make sure you check on your neighbor. And as always, thanks for tuning in to Canceling COVID. Enjoy your day.